Hi folks, and welcome to today's video, herniated disc recovery, why the medical system falls short. Now, first time here, I make a lot of great content for those folks that are suffering with low back pain issues, such as sciatica nerve pain, herniated discs, bulging discs, lumbar stenosis, lumbar arthritis. If that is you, then hit that subscribe button. You're gonna get notified and upload some great content to get you back on the road to recovery. But without further ado, let's get into today's video. Hi folks, so today I would like to talk about where the medical system can go wrong and why people feel very frustrated with the system when they are suffering from a herniated, bulging disc, low back pain problem, sciatica, lumbar stenosis, lumbar arthritis, one of the many afflictions you do get with lower back pain, okay? Now, let me first say what the medical system does very well, and this can be for socialized medicine, this can be for insured or joint in many places. If you have a serious injury, a lower back injury, herniated disc, bulging disc, okay, into the hospital, they will probably examine you with MRI, X-ray. If you've got cauda equina, some really severe nerve issues, you'll be operated on today with the technical tools, the ability of the surgeons. Amazing, okay? You'll get a really good result, normally. Okay, there's a caveat to that, which I'm not going to discuss on this video, but there has been incidences where a surgeon will not do as he said he did, but that's another story for another day. So typically, if your injury is severe, then yes, you will be able to get great care, you'll be taken care of, and it will happen pretty quickly, okay? It's after, this is where things tend to fall down. After your operation, or if your herniated disc is not severe enough for an operation, you very often get told, oh, just keep doing what you're doing. Or another classic one is just walk. Or do as much as you can without it hurting. Okay, now this, I've heard this from so many clients, so many people. One of my clients just now, she was telling me she had an operation, and after the operation, he more or less said, yeah, you're fine, just go about, just do it if you want to do, right? It's super vague, and you know, these people are well-trained orthopedic surgeons, neurosurgeons, you know, they're like high-level doctors, but they seem very vague with the information that they give to you. And in some cases, you'll be given a piece of paper with some exercises. I've had that from clients that have told me, right? You'll be told to, you know, go to YouTube. That's where you found me perhaps, right? It's crazy. And people say, why is it like this? Well, where's this disconnect? Well, essentially it's, you know, surgeons, their job is to operate. That's what they've trained to do, right? For rehabilitation, you have to go to a rehabilitation specialist, right? So we would normally call that a physiotherapist, rehab specialist. Some people may use their chiropractor, he may be trained in that type of thing. Some people go to personal trainers, strength coaches. Okay, there are people who can basically do a lot of these activities, but they just come under different names, okay? Now, there is a couple of issues with that as well, depending on the approach that you take or are given or recommended, okay? I'm going to go through a few pointers here. I've got them on my screen. Now, if the clinic you go to for rehabilitation is very much a cookie cutter, generic, get as many people through there as possible, you know, 3 people in, like the physio seeing 3 of you at the one time, one guy's got a shoulder injury, one guy's got a back injury, you're not going to get the best out of it, okay? You are going to be given most likely a very generic type of program. You may be given a sheet to go home with. I think in the worst case that I came across was a lady from the UK who was given a link to a application for her phone, and she was to follow the exercises within this application, right? No instruction, no personal oversight to see how she was doing, no feedback, nothing, right? Now, I think that's absolutely atrocious, because in that case, you could actually do more injury to yourself. You can end up in a worse position, okay? So if you do, when you go to the physio, if you physically go to physio, ask them some questions, okay? Ask them, have you had this injury yourself before? Actually, a lot of physios get into physiotherapy because they've overcome their own injury and they, you know, start to discover the body and they want to help people, okay, with similar injuries. So ask them, because if they've got experience, they'll be able to show some empathy with you. they'll maybe take a personal interest in that type of injury and your recovery, okay? You also want to ask them, have you worked with patients with my condition before? Because you can have herniated disc, but you can have multiple different symptoms. Some people have sciatica nerve pain, some people don't. Some people have back pain, some people don't. So it's good to get an idea and ask a couple of questions to your physiotherapist to see, look, are you competent? Are you capable? Okay. And I know that you may think, well, they've been to university, they've got the qualification, they should be competent. But believe me, mainly from my clients and some physios that I've met, you would not believe the lack of knowledge of physiology, biomechanics, that some of these practitioners, basically don't have, and they're working with people like yourself if you're injured, and it's really quite, upsetting to hear that. Now, the other thing as well within the plan is, and you should always ask this to your physio, is will this be a progressive plan with progressive overload? Okay, because you want a plan to be, guided, tailored to you. We want progressive overload where things are getting a little bit harder each week or every couple of weeks, because that's the only way the body will adapt, is when the exercises are made harder, and you actually will start to improve, get stronger and stronger. Because without it, if you're doing the same thing, week in, week out, your body's not going to have to adapt. So you're not going to make any changes. You won't get stronger. You're not going to get pain-free. Okay, and that's the ultimate goal, of course, is to get pain-free, moving again normally. Okay, so when it comes to the rehabilitation side of things, you have to ask those questions, and don't be afraid to ask them. Don't make them, making them feel. I wouldn't want you to think that you're making them feel, like they're lacking in knowledge, but you're a concerned patient, right? You just want to ask those questions to make sure you're comfortable going into that scenario. Now, I was talking to a doctor the other day, and he's doing my couple of weeks of my free advice program, and he also said the same thing. He said it's really interesting how, the doctor spends 4 to 6 years in medical school, then they'll go on to do their specialty, perhaps, orthopedic surgery, whatever it could be, but they don't know the basics, or most of the basics of the rehabilitation side. And I said, yeah, it's because they specialize in literally, I work on knees, I work on elbows, I do hips, I do lower back, yeah, and they know nothing else. And it is disturbing. My father-in-law just recently, he had a herniation, that's L3, L4. He had some pain down the outside of his thigh, so that's the femoral nerve, or lateral cutaneous nerve, sorry. And when my wife told me, I said, yeah, it's most likely, it's going to be L3, L4, L2, L3, around about there. And he goes in to see the doctor, and it's a surgeon, and he says, oh, yeah, you need a fusion. And they call me back, and I'm like, a fusion? He's still walking, okay, he's got pain, but a fusion, why would you fuse the spine? That's absolutely insane. And in this particular case, it was, in my opinion, money orientated, because they were getting paid, obviously, for the bigger operation. If you do a microdissectomy, which is a smaller operation generally to remove the disc material, you're under general anesthetic for a much shorter period. A fusion, where you're literally putting screws and nuts and bolts in and fixating the spine, gets paid more money. But in this particular man's case, my father-in-law, there was no way he needed that surgery. So also, when it comes to the medical establishment where it lets you down, is if you do go in and they're very eager to start slicing and dicing you, okay, and you don't have, bladder issues, you don't have drop foot issues in your nerve, don't be afraid to question the doctor. Don't be afraid to get a second opinion, okay? So, on the rehab side, though, you want to be asking these questions of the physiotherapist, the osteopath, person that you choose to use, yeah? Now, one thing which the program, many things it should include, but it should include, as I said, progressive overload. It should be timed, every 4 weeks things are changing. And you want to expect to probably be in rehab with going to rehab a couple of times a week at least, for at least 1 to 3 months, okay? I would say 1 month is very conservative. You're more likely, in my opinion, to be going there for 3 months would be the best, at least twice a week. And they should give you homework as well, because it's when you're doing the homework, all these other things, when you get home, like your exercises, etc., that's where you're also going to make gains as well. So it's super, super important that you do have all these things in place. Now, sadly, I know that you can't pick your health system if you live in a socialized medicine place, if you live in a, it's insurance-based. Again, I've heard the stories where, oh, hey, my insurance will kick in for a month, so I can't do anything for a month. Okay, guys, there's a video that's going to flash up at the end of this one, and it's a beginner rehab program that anybody can start no matter what stage you are. Okay, it's designed purely for sort of the ultimate beginner who's just been diagnosed with a herniated disc. It'll pop up at the end of this video. Check it out, because the sooner you start rehab, the sooner you can get back to full fitness, okay? The longer you leave it, then the much longer exponentially your recovery time will take, okay? So if you're, and I will say it's my home country, from the UK, and you've got like a 3, 4, 6 month waiting time to see an NHS physiotherapist, which is quite normal these days in the UK, then I would recommend you jump on that video. It's going to pop at the end of this one. Check it out and start working on something today, okay? There's another video that's going to pop up as well, because one of the things that they'll often tell you is just go walking, right? But how do you structure your walking, okay? How do you make sure it's not too much, like what's enough? So I've got a special video which is on walking, which will pop up at the end of this one as well. So there'll be 2 videos. There'll be one for the beginner workout, and there'll be one for walking, okay? Because those 2 are very, very important to successful recovery, all right? Now, another big area that I feel the medical system let you down with this particular injury is on the psychological side. Yeah, I'll check my list. Yeah. So many people are told, oh yeah, it's a 3-month, 4-month recovery. You'll be fine. Yeah. What they don't tell you is during that time you're going to have, you're going to be doing great, no problems at all, no issue. One morning you wake up and boom, you're in pain, and you're like, what happened? And you can't explain it. Did you twist in bed? Was it something you did the day before? And you get depressed, you get anxious, I've re-injured myself again, and I can't do that anymore. You start catastrophizing, I don't want to do this because I'm going to be in the same position, and you set yourself back, you get really depressed, you get really angry at yourself. And this happens a lot during the recovery period. And there's very few that I've come across, rehab specialists, physios, that actually implement some sort of psychological skills training with their patient, especially with this particular injury. Because the big thing with the lumbar herniated disc, lower back issues, sciatica nerve pain, which coming, from the lower back issue. And I say this a lot in videos. When you break your arm, get a cast on my arm, in the hospital, come home, got my cast on for 6 to 8 weeks, get it off, it's a bit stiff at the elbow, but I start to move it, okay? During that time, I can still eat my dinner, I can still, walk across the room, I can still get up, I can pick things up with my left arm. I break my leg. I've got a cast on my leg. Say I broke my leg above my knee. I've got my crutches, okay? I can sit in the chair, no problem, right? I can hobble around on my crutches, no issue. When you've got a low back issue, because it's literally center point of your body, okay, it affects all aspects of your life, yeah? Walking, driving, sleeping, just generally moving, brushing your teeth, sitting to watch TV, all these things, yeah? And it really hits home that, oh my God, this injury is affecting all areas of my life. And many people get very down with it, they get very depressed about it. And again, the medical system does nothing that I've come across. They don't, give you some sort of, guides to help you get over things, to recommend things. But I do say to people, look, journal. Journaling is massive. I keep talking about it a lot, but if you journal activities you've done on that day, stress levels, pain levels, what it is you were doing, steps walked, water drank, liters, fluid ounces, whatever it could be. If you keep that daily, you'll start to see patterns, like you're improving, you did more steps this week, you did extra exercises this week. And then if you have a bad day, quite often it will actually show you within the guide, within your little feedback form you're filling in yourself, what you did wrong. Oh, that day we did the big hike up the hill, or we helped my friend move some furniture. You can start to spot pain triggers, but you'll also see how far you've come. Yeah, because I will tell you, I'll be perfectly honest with you, setbacks, okay, will happen, all right? So be ready for that. as I said, generally the health system will not help you in that regard, okay? You have to, basically, I will actually pop a video, because I can't put all these videos up at the end. I'll put a link to a video down below, which is one on psychological skills training, actually, just very, very basic, on cognitive behavioral therapy, which will help you kind of help to reframe, train the reframing of thoughts as you move forward, okay? So there's a lot of things to think about there. And as I said, there's a few things that, you know, the medical system will not serve you well on, okay? But yourself, how can you ensure that you're going to get the best recovery possible, okay? So I've got a list of 5 here. Educate yourself. Now, if you're watching my videos, hopefully I am educating you on this particular subject, okay? The videos I create are, I say, true and honest, okay? Why would they not be true and honest? Well, you know, people want to get clicks, they want to do different things for clickbait. So certain practitioners will speak about certain concepts which are not 100% exactly true. I am very research-based. I do scour the literature. I've used the literature a lot. I will use the inference from the literature plus practical experience to come up with the theories that I apply to my clients and what I talk about on these videos, okay? So when you educate yourself, there's a lot of great books, okay, you know, Stuart McGill, Robin McKenzie, there's a variety of good books out there that will help you understand how the body moves, what you should be looking at. There is, you know, a handful of guys on YouTube that are very good with low back stuff, okay? So you want to, and if there is something conflicting, you know, feel free to ask me a question in the comment section. I will happily answer it. I do that many, many times, okay? So educating yourself, and that also involves, you know, asking your physio if he's ever had this injury, asking your doctor as well about, look, you know, is there the chance to get physio sooner rather than later? You know, so you're trying to educate yourself about the whole concept, and hopefully this video is helping in that part, right? So number 1, educate yourself. 2, start a structured program. Now, I spoke about it before. I'm not going to linger on this subject, but if you've not started already, get yourself into a rehab program now. The video is going to pop up very, very soon. That is a program designed for when you've just injured your disc, low back disc. Jump into it now, okay? So 2, start a structured program. Number 3, I discussed it just a few minutes ago, journal and monitor your progress, okay? Make sure you're journaling, track your progress, okay? Because it's going to help you in the long run see your wins, your gains, because when you have that setback, which you will do, you can look back and go, I have come so far to this point, okay? So number 3, journal. 4, get support, okay? This is very, very important. I always ask a lot of clients, you know, potential clients, you know, do you have a partner living with you, brother, sister? Are you living in your family, on your own? Because having that support around you and you telling them, look, this is my injury, I'm feeling terrible, I can't do these different things, please help me out, okay? It's a pretty cold-hearted person who's not going to help you and understand what you're going through, okay? They might not have 100% empathy for you because you don't look injured, which is often the case with a low back issue. But if you tell them, okay, and it is a good partner, a good friend, a good family member, then one would hope they can help you with, you know, chores, moving stuff, etc. They won't expect as much out of you possibly as they did before because you're not as physically capable, okay? Now, I just want to finish number 5. It might not seem like a big one, but it is a big one, is respect your nervous system, okay? What do I mean by that? Right. When you have generally a herniated disc, very often you will get sciatica nerve pain. And it's very easy to irritate that nerve with daily movements which are not conducive to good movements of the spine. So flexing forward. If you've got a herniated disc, which is protruding backwards, protrusion, posterior, I flex my spine forward, the disc pushes out more, pushes on that nerve, bzz, and I get the sharp stabbing pain in my leg, okay? You want to avoid, if it's the first 4 weeks of your injury, I would avoid flexion, bending the spine, before noon, okay? Try to keep that flexion to a minimum to keep the stress off that nerve. If you keep irritating the nerve, the longer it's irritated for, and the more sort of like, you know, you've got numbness, etc., then there can be permanent damage down the line, okay? So always respect the nervous system. But at the same time, a good program should include some sort of neural flossing, nerve flossing, where you're trying to sort of get the nerve to move gently, mind, right, around that disc material, which will help to calm down the nerve, get it moving properly, and again, much better prognosis for the long-term recovery, okay? So, just those 5 again. Educate yourself, start a structured program, make sure you journal and monitor your progress, get support, and respect your nervous system, okay? Guys, listen, don't forget those 2 videos are going to pop up in just a second, okay? Don't forget, of course, to like, share, and subscribe. And look, if you've got comments, questions, hit me up in the comment section down below. I always answer them. It might take me a week or so to get to them because I am very, very busy, but I will answer those questions. All right, guys, check out the videos. Have a great day, and I'll see you soon.